While approximately 150,000 women of childbearing age are getting diagnosed with cancer and other ovarian-harming diseases each year, it is crucial to have and make public options for fertility preservation. While the freezing of eggs is often advantageous if already fertilized, there are newer options to successfully preserve eggs that have not yet been fertilized, which gives room for the mother to have their biological child and have it with who they want. Ovarian transplants are also impossible because of the inability to find a perfect match, which leads to the necessity of a homograft. A newer and more attractive way of preserving fertility is through laparoscopic ovarian transposition. What's harmful about cancer treatment? Chemotherapy, specifically alkylator types, and radiation. Every tissue in the body has a specific amount of radiation it can withstand and still function correctly. Ovarian tissue maxes out at around 10 grays, which merely defines how much radiation is being absorbed by the body. After about 10 to 20 grays, the ovaries will stop functioning. The radiation targets the nucleus of cancer cells to destroy DNA and kill cancer off, but the radiation can also harm the DNA of healthy cells. Since women are given as many eggs as they will ever have at birth, if radiation gets a hold of them, it becomes a dangerous battle to maintain the ability to have children. But what can target the nucleus of microscopic cells? Gamma rays. The tiny wavelength of gamma rays and its high frequency make it available to penetrate most anything. Ionizing radiation can cause direct damage to ovarian follicles. When the energy stored in the radiation is high enough to be breaking off electrons from the atom, then it sure as heck can kill some ovarian follicles, which rapidly decreases the ability to fertilize. Ovarian follicles are cells in charge of releasing eggs during ovulation. How can ovaries avoid being harmed by ionizing radiation or gamma rays when there is a cancer in the area? Move them. Ovaries can be transposed into many parts of the body, and especially the forearm. Another word for ovarian transposition is oophorectomy, and when this is practiced before surgery to the pelvic area, there is a valid 100% fertility rate. After a vaginal brachytherapy or internal radiation, though, the fertility rate drops to 90%. While it is useful to move the ovaries out of the way to protect them from the tiny little killers that are gamma rays, there is still the ability to harm them, as seen with internal radiation. Because the radiation is now inside the body of the woman, they can travel further and cause effects to carry throughout the body and risk harming more tissue than just in the pelvis or transposed ovaries. One of the only materials dense enough to barricade gamma rays is lead, but it cannot be ejected into the body because of the risk of lead poisoning. Lead shields for typical radiation tend to be highly efficient, but when dealing with vaginal brachytherapy, it can be nearly impossible to guarantee protection from radiation. If cancer is aggressive enough in a young person who is still of childbearing age and brachytherapy becomes necessary, anyone wanting to have their children should transpose their ovaries and freeze their eggs to provide them with the highest chance of fertility.